Hi, my name is Grant, and today I will be analyzing a gait impairment focusing on excessive lumbar extension. Excessive lumbar extension occurs when lower back is overly arched during movement. This is often due to anterior pelvic tilt. This matters because it increases the stress on the lumbar spine and can lead to low back pain and reduce overall movement efficiency during running or walking. The anterior pelvic tilt, or the rounding of the lower back during the gait, will look something along these lines. As you can see, I have that rounded lower back. Pelvis is anteriorly tilted, and this is going to be caused by tight hip flexors and weak glutes. Today I'll be going over 4 corrective strategies to help improve the rounding of the lower back. First corrective exercise, we're going to be doing an inhibitory technique. The first step in inhibitory techniques is using self-myofascial release to loosen or release the hip flexors. So what you're going to do, you're going to get a foam roller, and you're going to want to place that foam roller on your hip flexors, like so. You're going to want to keep this leg bent at a 90 degree, and you're going to rock back on this and find your tender spot and keep holding that for about 1 to 2 minutes. And like I said earlier, you're going to want to hold in those tender spots to really make sure you're releasing those hip flexors. This is really important because we are going to want to loosen or deactivate those overactive or tight muscles. That way we're not having these structure problems like the anterior pelvic tilt. Next, we're going to be doing the lengthening technique. We're going to be doing a static stretch, a kneeling hip flexor stretch. So what that's going to look like is you're going to be kneeling like so. You're going to want to keep an upright torso, head facing forward. And what you're going to want to do is lean forward like so, holding for about 30 seconds, really getting that hip flexor stretch. If it is a rectus femoris issue, you're going to want to do this with a partner and have them pick up on the back of your foot to make sure we're stretching that rectus femoris. It's important to do to maintain a posterior pelvic tilt during the stretch to effectively target these hip flexors. And the reason we're doing this is because we're trying to lengthen them, not just unactivate them. Next, we're going to be doing isolated strengthening. And for our isolated strength exercise, we're going to be doing glute bridges. The exercise should be performed 2 to 3 sets, 10 to 15 reps, with a 2-second hold at the top. The focus is on activating the glutes while keeping the core engaged and avoiding excessive arching in the lower back. This helps restore proper pelvic control. The glute bridge should look something like this. The reason we are doing isolated strengthening on the glutes is because of that anterior pelvic tilt. The glutes are not contracting while we are walking, keeping that posterior tilt, or at least keeping it neutral. So we're going to want to be strengthening those glutes to make sure that our gait gets back to normal. And one way we can enhance our isolated strengthening is by adding weight or resistance bands, things like that, to increase resistance as adaptation occurs. And lastly, we are going to be doing our integrated dynamic movement. We incorporated the squat with proper core bracing. It should look something like this. Making sure that we're keeping that neutral spine, chest up. Like that. This is going to be performed 2 to 3 sets, 10 to 12 reps, and we're going to be looking to strengthen our overall leg structure as well as increase core stability. We're really wanting to reinforce proper movement patterns by controlling or combining core stability with lower body movement. All of these exercises should be performed 3 to 5 times per week at a controlled intensity, focusing on proper technique. Contradictions include avoiding excessive lumbar arching during our exercises because we are wanting to improve that back arch during our gait. So when lifting and doing these exercises, we're going to really want to focus on keeping that neutral lower spine. And progression may include adding resistance, like I said earlier, or moving to single leg exercises, while regression can include reducing range of motion or adding support for stability. So in conclusion, addressing these overactive hip flexors and underactive glutes and core activation, and reinforcing proper movement patterns, we can use these implemented corrective exercises to improve that lower back arching during our gait.